Types of jaundice. What is jaundice? Jaundice means a yellowing of the skin, eyes, sclera, and mucous membranes. It is known as icterus in medical terms. It is also known as piliya in the third world. It is caused by too much bilirubin in the blood, indicating the liver isn't properly processing it. Now, the most common question asked: is jaundice harmful? Jaundice itself is a symptom, not a disease. And its potential for harm depends entirely on its underlying cause and the age of the person affected. In children and adults. In many cases, it itself is temporary and harmless. But it can also be a sign of serious, even life-threatening, medical conditions that require prompt treatment. In newborns. Jaundice is very common in newborns, and is usually a normal, temporary condition as their liver matures. Most cases resolve on their own without treatment within 1 to 2 weeks. However, in rare cases, bilirubin levels can become dangerously high, leading to a type of brain damage called kernicterus, which can cause permanent issues like cerebral palsy or deafness. Medical providers carefully monitor newborn bilirubin levels to prevent this. Treatment with phototherapy, belly lights, is common and effective if levels are too high. Let's get to the main topic. What are the types of jaundice? Jaundice is categorized into 3 main types, depending on where the bilirubin processing goes wrong. These are prehepatic jaundice, hepatic jaundice, and post-hepatic jaundice. Let's discuss them one by one. Number 1. Prehepatic jaundice. Prehepatic jaundice occurs when there's excessive breakdown of red blood cells. This is called hemolysis. This overwhelms the liver's ability to process the excess bilirubin, leading to a build-up of unconjugated bilirubin in the blood, thus causing yellowing of the skin and eyes. It happens before the liver gets to process the bilirubin. Why the name? Prehepatic? The name reflects that the issue occurs before the bilirubin reaches the liver. The excess bilirubin is produced from hemoglobin breakdown, before it can be properly handled by the liver's conjugation process. Hence the name, prehepatic, or hemolytic. Common causes of prehepatic jaundice are genetic blood disorders. This includes conditions affecting red blood cell structure or function, such as sickle cell anemia, has abnormal hemoglobin. Hereditary spherocytosis, has sphere-shaped red cells. Thalassemia, has irregular hemoglobin. Infections include parasitic infections like malaria. Hemolytic anemias. It is a group of disorders where red blood cells are destroyed prematurely, including autoimmune types. Massive hematoma reabsorption. The body reabsorbing a large bruise or internal bleed. Number 2. Hepatic jaundice. Hepatic jaundice is also known as hepatocellular jaundice. It happens when liver cells, hepatocytes, are damaged and can't process bilirubin properly. How does it happen? Normally, the liver conjugates bilirubin. That means it makes it water-soluble, and then excretes it into bile. In hepatic jaundice, liver cell damage impairs this process, leading to bilirubin accumulation in the blood, resulting in yellow skin and eyes. It often presents as a mixed picture, with both conjugated and unconjugated bilirubin elevated. Following are the causes of hepatic jaundice. Viral hepatitis. It is inflammation of the liver from viruses, like hepatitis A, B, C. Alcoholic liver disease. Liver damage from heavy, long-term alcohol use. Cirrhosis. It is the scarring of liver tissue, reducing its filtering ability. Liver cancer. There are cancerous cells multiplying in the liver. Drug toxicity. Certain medications, like high doses of acetaminophen, can harm the liver. Autoimmune conditions, like autoimmune hepatitis. Number 3. Post-hepatic jaundice. Post-hepatic jaundice is also known as obstructive jaundice. It occurs when there's a blockage in the bile ducts, preventing bilirubin from draining out of the liver into the intestines, causing it to back up into the blood and skin, leading to yellowing. Primarily conjugated bilirubin builds up in this type of jaundice. Why it's called obstructive jaundice? The jaundice is caused by an obstruction, blockage, in the bile drainage system, which leads to bilirubin backing up into the blood. Other names of post-hepatic jaundice are: it's also sometimes referred to as extrahepatic jaundice, as the blockage is outside the liver, in the common bile duct. Its common causes include gallstones. It is the most frequent cause, blocking the common bile duct. Pancreatic cancer. The tumor in the head of the pancreas obstructs the duct. Bile duct tumors. It includes cholangiocarcinoma or other malignancies. Strictures. It is the narrowing of the bile duct from inflammation or disease. Parasites. It is the infestation within the bile ducts.